guys, thanks so much for coming out here to watch this. I was really up in the air about doing another episode on our nemesis, COVID-19, but just some of the information out there, I thought it was important to share because you guys don't have the time to do the research. And some of you are already aware that one of my favorite pastimes is research. And not just for COVID-19, but for any medical ailment. This week, I'm focusing on COVID-19. Next week, I'm going to look at gastroparesis because, well, you know what really shocked me about gastroparesis is how incredibly common it is, especially as we age. And for those of you who are lucky and don't know what gastroparesis is, it's when your stomach stops emptying in a typical fashion. And what that does is it causes incredible pain, bloating, nausea, and vomiting. It's just a horrible deal, but that's next week. Now, when we talk about research, just a few weeks back, I did an episode on one of the things that's really important for you and your health, and that's becoming your own patient advocate. But to do that takes a lot of research, and it can be another full-time job. Here is where you can get a summary of critical information that is important to keeping you healthy, alive, and vibrant. Now, let's be real. There is going to be some great information here and some not so great. We are all suffering from quarantine fatigue, which means our nerves are a little bit frayed. Right now, this might be too much information for you. Make some real judgments on where you are emotionally and where your mental health is, and really think if you can handle science. If you're going to continue, come on, let's get started. Okay, first the good news. Over the past few months, there has been a reduction in mortality rates with COVID-19. One study that's often cited is the trends in COVID-19 risk-adjusted mortality rates. This was published in the Journal of Hospital Medicine, and they found a decline in mortality rates. And when looking at all the COVID-19 patients admitted to the hospitals in New York between March and August of 2020, the adjusted mortality rate dropped from 25.6 in March to 7.6 in August. I am going to put links in the video description below to all of the references in this video. So if you want to look at it in more detail, you can. The current information highlights 3 different potentials for the lower mortality. And the first is going to be that mutation, the D614G in COVID-19 that was first identified in February of this year. Now, they think this mutation is more contagious, but it might be less lethal. The mutation is in nearly all the viruses isolated worldwide today. The second reason for the lower death rate, maybe we better understand how to treat COVID-19. What is the true driver of the reduction in mortality rates could be one of these 2 factors, or it could be something totally different. What is known for certain, mortality rates have been declining, which brings up the next bit of information. This virus may be dose dependent, and 2 things are going on here. Since March, people have been testing with lower viral loads, and recent research suggests that dose might matter. So when we look at the dose concept, the recent study published in October 2020, that's this month, identified a correctional facility employee in Virginia who had multiple brief exposures, so less than a minute, and became infected and symptomatic. And he was masked up, so it wasn't like he was running around not with a mask. And prior to this study, it was believed that you had to have continuous close exposure of 15 minutes or longer to an infected person. Now, over 24 hours, you can have multiple brief exposures of less than a minute and become infected. It almost suggests that you can amass the virus, almost like your body is your bank savings account. Each subsequent deposit increases the balance until you get sick. And that would suggest you can continue to increase your balance with more exposures. Okay, so remember at the beginning of the pandemic where cities had such a hard time? As infection rates increased and living in those tight quarters, the opportunity to be briefly exposed multiple times increased. So maybe the number of infected, which increases your chances of interacting, increased your viral dose. And at the height of the infection in New York, about 30% of the individuals testing for COVID-19 were coming back positive. Although no research study has had the opportunity to test it, it may be there's no upper limits on how much virus can be introduced to the body. So you can be sick and exposed to more virus through people or items, which increases your viral load. At the beginning of the pandemic, way back at the beginning of the year, the viral loads were significantly higher and there was a higher mortality. That comes to the second statistic. The second statistic is people sick today are showing lower viral loads. And there's been two studies. One was done here in the United States at Wayne State University in Michigan, and there was another one done in Italy. Both of these studies were presented in September to the European Society of Clinical Microbiology and Infectious Diseases. These studies found that social distancing and masks reduce the dose of virus people are receiving. And the studies found the lower viral loads resulted in a less severe illness and lower mortality. So, the lower mortality rates might have nothing to do with the mutations or the improved medical treatments and everything to do with social distancing and masks. Or it could be a combination. We just don't know. When we talk about social distancing and masks, we've been in this COVID-19 pandemic for a while, and we forget why we're doing this. The goal of the social distancing and mask had been twofold. At the start of this pandemic, there was an opportunity to starve the virus of hosts and thus completely wipe it out. But, today, as new documented infections soar to over 70,000 a day in the U.S., that goal seems more like a pipe dream. And the second goal was to reduce the infection transmission to give our medical community time to find treatments or vaccines. Now, New York was the first city to show us the extent of damage this virus can do to our healthcare system. Later, the state of Georgia followed suit, filling hospital capacity around July 22nd and implementing quarantine requirements. And today, Georgia remains at a level 3 risk by the CDC. This virus has long hospitalization times. Patients can easily consume beds for over a month. There will always be a percentage of infected who will need to be hospitalized. As the number of infected goes up, the number of people hospitalized is going to be going up. Although we only have so many hospitals, I'm starting to think that our real juggernaut is going to be in medical professionals. I was just reading through the situation in Idaho. They have these public health districts, and there's 7 of them, and they're not affiliated with any state agency. I guess they have the authority to mandate masks. Well, right now, Idaho's experiencing a spike in COVID-19 cases. In Coeur d'Alene, which is located in, I think it's pronounced Kootenai County, the October 22nd meeting of the Panhandle Health District, which controls that area, the medical community from the area actually came to ask the board to support the mask mandates because the hospital in Coeur d'Alene is 99% full and the staff have been overworked for 7 months. They're exhausted. I can't even imagine because I'm exhausted without the added stress of working in what our hospitals are becoming, which are battlefield hospitals. I was reading through some of the board members' reactions, and it really highlighted the difficulties local governments face, how that lack of support from other agencies leaves these officials at the mercy of the mob. One of the critical lessons we learn as parents is you have to have a consolidated front when addressing situations with your children. And if you don't, you're left open to chaos. And that's really what I heard when reading through the comments from the board members. One of them, who is the most at risk of dying from the disease, stated, I personally do not care whether anybody wears a mask or not. If they want to be dumb enough to walk around and expose themselves and others, that's fine with me. Nobody's wearing that damned mask anyway. I'm sitting back and watching them catch it and die. Hopefully, I'll live through it. Wow. How tragic is that? You're in a position where you don't feel empowered to even save your own life. Idaho has a pretty low test rate. They are only testing 1.4 persons per thousand, so probably one of the lowest in the nation. And of that, over 30% are coming back positive. So in this situation, we can see that the percent positive can provide context about case totals and not trends. It is not a measure of how prevalent the virus is in the communities, because I bet in this situation, if they had more testing, the percent positive would be lower. Okay. Enough on why we're using masks and social distancing, because this next section is crazy. Candida auris. Have you heard of it? And before you say yes, this isn't Candida albicans. Candida albicans is that yeast that causes thrush and is blamed when people say they have too much yeast in the body. Candida albicans is not Candida auris, because Candida auris has a mortality rate of 30 to 60%. So let me give you the skinny on this. Candida auris first appeared in 2009 in the ear of a patient, which is how it got its name, Candida auris, a yeast infection of the ear. At that time, it bloomed in 4 different geographic areas in the world, and researchers thought this 4 blooms that happened at the same time, they would have the same origin. It turns out they don't. Each infection had a separate origin, and that was a little disturbing. You know, in 2017, we had an outbreak, and we seem to have gotten it under control now. Now, as an FYI, I have a news break playlist where I save videos to track progress on creepy things that happen in the medical world. And I have the 2017 video from Tom Chiller, the head of the Mycotic Diseases branch of the U.S. Centers for Disease Control and Prevention, talking about this superbug. And why I even bring this up is I was reading my National Geographic this month, and the headline article was, "Drug-resistant superbug thriving in hospitals hit hard by COVID-19. And my thought was, really? Oh, crap. I'll link that article in the description below, because it goes over some of this stuff in great detail in real people speak instead of that incomprehensible medical speak. And what I like about the National Geographic article, if you do it online, they have these links to all the information that they're referencing, and it makes it really easy to track the information. But the skinny is that this bug likes hospital settings. It's virtually indestructible. And last year, the CDC classified C. auris as the drug-resistant threat in America, or one of the biggest drug-resistant threats in America. And look at how many cases are recorded in 2018. So going to the Tracking Candida auris page of the CDC, what I really like about this page is 2 things. Look at this map of the U.S. You can easily see where this bug has been reported. And then you can get the total number by state. And here is some footnote information that's pretty phenomenal. So the U.S. has 1,364 total cases. And what's interesting is there's 2,737 patients that have been found to be colonized with C. auris. And what that means is that these patients are carrying it on their body, even though they're not sick with the infection. So, wow, huh? Okay, and another wow, we've already hit the 16-minute mark. So I think what I'm going to do is I'm going to call it a night here. There's a couple more things that I think are really important and I'd like to talk about, and that's the flu for this year, and also some of the research on treatments for COVID-19. And what I think I'll do is, I guess I'm going to have to do a second episode. Then I'll do the gastroparesis after that. Okay, guys, thanks so much for the love and the subscribes. Stay safe out there, and until next time, I'll catch you on the other side.